Planking is an outstanding exercise that simultaneously activates multiple muscle groups, aids fat burning, and enhances overall vitality. In this video, you'll discover the benefits of planking, find out if it's potentially harmful, and learn the correct plank technique along with essential safety tips. So make sure to watch all the way through. Let's dive in. The plank is a versatile exercise performed by holding a static position on the floor. The classic plank ranks among the most effective ways to tone your body, burn belly fat, and strengthen your glutes. Many people, especially those with sedentary lifestyles, experience back pain. When done correctly with proper form, planking can significantly build back muscle strength, improve posture, and alleviate discomfort. Interestingly, the plank is also a yoga pose. Despite its simplicity, it engages nearly every muscle in your body. The best part? With regular practice, you can start seeing noticeable results within just 1 month. A strong core leads to improved posture, fewer injuries, and greater overall strength. Additionally, well-developed core muscles provide a solid foundation that protects your internal organs. You might be curious, why hold a plank for exactly 2 minutes? Research indicates that maintaining a plank for 2 minutes strikes the perfect balance between developing strength, enhancing endurance, and avoiding fatigue. If you can keep proper form for this duration, you're well on your way to a strong, stable core. What makes the plank so effective? At first glance, it may seem challenging, but there's no need to worry. This exercise demands little time while delivering significant benefits. Best of all, anyone can learn it. For men especially, the plank is beneficial during cutting phases. Studies show that static exercises like the plank efficiently burn fat. They also boost endurance and encourage balanced abdominal muscle development by working both the abs and back at the same time. Women often include the plank in their fitness routines to reduce cellulite, tone arms, and sculpt a defined waistline. After childbirth, it can aid in restoring abdominal muscle tone, but consulting a doctor first and waiting at least a month before resuming is crucial. While planking is excellent for weight loss, remember that exercise alone isn't enough. Maintaining a calorie deficit through diet is key for optimal results. You can also experiment with different plank variations or switch between them to increase effectiveness. Consistency is essential, and with regular practice, you may start seeing visible improvements in as little as 2 weeks. However, the plank isn't suitable for everyone. Some may struggle to hold the position for long, especially beginners. To avoid health risk, it's important to be aware of contraindications. Pregnant women should avoid planking entirely because it strains the abdominal muscles and could lead to complications. Those with herniated discs, recent spinal surgery, or pinched nerves in the back, neck, or shoulders should also steer clear, as the exercise may worsen these conditions. Additionally, people with certain internal organ issues where intense physical activity is prohibited by doctors should not attempt planking to prevent adverse effects. How do you do a plank properly? It might look effortless watching someone hold the pose still, but in truth, it takes considerable strength to maintain perfect form while balancing on your forearms and toes. To perform it correctly, begin on the floor as if preparing for a push-up. Bend your elbows to roughly a 90-degree angle and rest on your forearms. Your body should form a straight line from head to heels, like a taut tightrope. Keep your core tight, pulling your abs in and activating all muscles to maximize the exercise's benefits. For the perfect plank, keep these tips in mind. Relax your neck and head to avoid tension, and gaze down at the floor rather than looking up. Position your elbows directly beneath your shoulders to evenly distribute weight and prevent strain. Avoid shrugging your shoulders. They should remain level and steady. Maintain a flat lower back. Don't let it arch or round. Tighten your glutes so they align with your back without lifting too high. Engage your core by pulling your stomach in firmly. Regarding your feet, you can keep them shoulder width apart or closer together. Bringing your feet closer intensifies the workout and focuses more on your core. And don't forget to breathe deeply, slowly, and steadily throughout. If the basic plank feels too easy, try more challenging variations like the side plank or plank to push-up transitions. These engage more muscles and add intensity to your routine. How long should you hold a plank? That depends on your fitness level. Proper form is more important than duration. Beginners should start with 10 to 15 seconds and gradually build up to 1 minute with regular practice. Intermediate exercisers can aim for 50 to 60 seconds, repeating 4 times daily. Advanced fitness fans should try holding a plank for over 2 minutes multiple times a day to maximize benefits. If you can't hold a plank for 30 seconds yet, don't get discouraged. It's far better to hold perfect form for a shorter time than struggle through a poorly done 2-minute plank. Start small and build your endurance steadily. What's your longest plank hold? Share your record in the comments below. See you next time.